Your Carolina is here at ReGenesis Health Care in Spartanburg, and of course, during February, everyone's talking about heart health and really knowing their numbers and knowing how to improve that health. I'm here with physician's assistant Stephen Behan. Thank you so much for being here with us. I appreciate it.
Yeah,
and actually, I'm at your house today, which is great here at ReGenesis.
Yes.
Let's talk about it. Of course, February, a lot of people are talking about heart health and really honing in on that. And of course, the #1 killer of women, so people want to make sure they know their numbers. Talk about what puts someone's heart at risk?
Yeah, absolutely. So it's not women only, it's the nation as a whole. It is the #1 killer in the entire country. And also, more specifically, South Carolina and the upstate, it claims 1 in 5 people.
Wow.
So the risk is very real. What puts your heart at risk? A number of things that we do monitor and try to manage, namely blood pressure, cholesterol, your sugar, your inactivity, potentially unhealthy weight that you might be carrying, your diet, smoking, alcohol. There's a lot of things that we can discuss and look into. And the great thing about heart health is that small changes do make a really big difference, right? And we can address those things early on before they're huge problems like the heart attack that everybody thinks just comes out of nowhere. It doesn't come out of nowhere. It's from small things that we are or are not doing, like regular exercise, even small 5-10 minute increments of physical activity during the day goes a long way. Deciding healthy habits that we choose in the kitchen, avoiding highly processed food, sugars, excessive consumption of alcohol is a risk factor. Certainly smoking is one of the largest risk factors for heart disease as well.
Yeah, so taking a look at your lifestyle day to day and making some of those modifiable changes and saying, instead of eating fast food, 5 times a week, maybe it's just a one-time thing that you do, and making the things you bring your lunch to work, make sure you're making some healthy choices there as well. So having that conversation with your doctor and making sure that you're looking at those things that you can change.
Yeah, absolutely. And that's what the first step is, because you can't manage what you don't monitor. So the first step is what do we need to address? And that starts with coming in and getting established with a medical home and figuring out what your numbers related to heart health are. Particularly, we're really interested in your cholesterol, your blood pressure, and your A1C, which is a 3-month average of your blood sugars that screens for diabetes.
And so knowing your numbers, that's what that means, coming in and knowing exactly where you are on this chart to know how you need to address it, because everyone's very different.
Absolutely, and it's very personalized. So there's blood work that we would do, but it's a very specific and tailored conversation that you would have with your medical provider. So if somebody doesn't have a medical home, here at ReGenesis we are taking new patients. We love to partner with anyone really that wants to address their heart health and know their numbers and take ownership of their health.
And it's something you want to take action on, right now. For people that say, well, I go once a year, how often should we be coming to see our doctor to check those numbers and make sure we're making the best choices?
Yeah, initially that's great, right? A young, healthy individual, that's great. If anything's identified, there are abnormalities in those numbers, then certainly we would follow up as appropriate and what's recommended.
Awesome. Well, great information. And now is a great time that when everyone's talking about heart health, it's the month of the heart and love and all that. So make sure that you're taking care of your heart health. Stephen, thank you so much for having us in today. Again, if you're looking for a place to take care of all of your healthcare needs, you can go here to ReGenesis. The address is on your screen. myrhc.org is the website to check it out. Stephen, thank you.
Thank you.